So fluoridation is the single most cost-effective way we have of improving oral health outcomes for children. It makes the biggest difference to our poorest and most vulnerable children. What fluoride does is it works mostly on the flat surfaces of teeth, the fronts that we see. Having missing, filled or holed teeth, particularly in the front, seriously impacts on children's future life chances, in particular their chances of getting a high-paying job. It also impacts on children's respiratory health and cardiac health. So we need to do everything we can, particularly for our poorest and most vulnerable children, to give them the best possible life chances. Fluoridation does that. Most public health interventions involve a choice of rights. Often that's between our right to choose or personal freedom versus a public good. So examples of that include having chlorine added to our water supply, requiring that children wear cycle helmets or use booster seats in cars. And we all accept that these are public health goods and advantage our children, and so we accept those. Fluoride in our water supply is like that. We have a right to choose what's in our water, but children also have the right to the best possible health, and as a country we have a responsibility to do the most that we can to improve their health outcomes and to reduce inequalities. Fluoride is the single most cost-effective way we have of reducing those inequalities for children's oral health. In my view, the small cost of not being able to choose what's in our water is worth the large benefit to those children. You might see some debate about the science of fluoride. In fact, the science is settled. The World Health Organization, the US Centers for Disease Control, the New Zealand Medical Association, dental associations all around the world are all in universal agreement. The benefits of fluoride outweigh any tiny risks. There is no debate in scientific circles about the merits of fluoride. Anti-fluoridationists will tell you that there are risks to fluoride. They'll cite fluoride as being a poison, for example. Any substance in excess is harmful. Sugar, oxygen, water are all dangerous in excess. In fluoridated water supplies, the concentration is 0.7 parts per million. That is enough to protect our teeth. It's not enough to do any harm to any part of our body. The science is quite clear. At that concentration, fluoride benefits our health and it doesn't do harm.